my son and my daughter here with their grandkids. So we have 5 kids in the house,
Wow.
5 grandchildren and about 4 adults, and they're all going to be eating pizza in the next room over. So it'll be interesting to see if the kids can use their inside voice.
Gotcha.
No
Not
fun.
gonna happen.
Not
Don't
going to
count
happen.
on it. Mine's in bed, so you won't hear from her.
Rick, that's yet another reason. Let's have a nice quick meeting tonight. I don't know if it's
Yes.
possible, but
Bang, bang.
Again, why I sent out that packet so you can read at your leisure
yay.
and not hijack the meeting tonight.
And we got personal with Rick, but you're out of town too, Kevin, right? You
Yeah,
with
down at
family.
my folks' place down in Marshfield.
Nice.
And I can attest to what Rick said. It's honestly been the worst July I can remember.
Oh,
Mm,
terrible.
I mean, the average temp so
Terrible.
far has got to be what, 62?
right. I know.
Awful.
But today was nice. The marine layer finally burned off today. It's been sitting on us for like 3 days now.
Yes,
Exactly.
Carrie.
Hello.
Hi,
Carrie.
Hey, Carrie.
Hello.
What are you laughing at?
Carrie
Do I look
popped
as
right up.
huh?
Hey, Gary.
Hi, Kevin. How are you? Hey, Rick.
Hi.
Have you slept lately or anything, Carrie, or what? Earlier, Gene was like yawning away. I'm thinking, you guys burning the midnight oil over here.
Coffee.
Year end is not for the faint of heart. I don't know if that's Gene's game, but that's what's happening here. Year end and New Year starting at the same time makes things really interesting.
Okay, I'm going to call the meeting to order. We're all here. And just to review the agenda, we have public comment, but there doesn't seem to be any public online. We're going to review the MAPC, some of the elements of that project that Jean will lead us through. Do a quick update on the health director position recruitment. Kevin sent that packet on the coalition, which was very helpful and very thorough. And maybe Kevin can highlight if there's any 1 or 2 things he wants to point out. And then we have the monthly health division report where we have some actual sort of regulations we want to update and a few other things in addition to the routine data. And then we'll review the minutes from the June meeting. We have some scheduling issues for September through December. We'll go over and then we'll wrap up unless there are any other issues. So that is the plan. And so maybe we can go right to the MA.
Recording in progress.
Maybe we can go right to the MAPC piece. And I don't know, Jean, if you want to kind of lead us off.
Sure. So we've been working with MAPC on fine tuning, as we discussed. The board has seen the scope. I think Peter resent it in the packet. So that's the same scope that you saw, and we wanted that to accurately reflect what the board has voted on. So some of it was outdated, so you saw a little bit of bold and cross out where some things have changed. That's why that looks a little messy, but we wanted it to be from the original scope that you all saw and approved. So that's the scope. There was a little bit of a timeline that went along with that. The goal is to get this project done by the end of the calendar year. And the key elements, I think, for discussion tonight are around the work plan piece that really speaks to which peer communities are good models for Reading, good comps, and who are the best key informants for the key informant interviews. So those were the two pieces that we made clear to MAPC. We would like the board to weigh in on and be a voice on. And I think the board has been clear that those elements are really going to drive a lot of the data that gets analyzed. The third piece that we don't have for tonight, and that's why MAPC is not joining us, is we're still waiting for the subject matter expert. As we all know, Sam Wong is no longer available, but we had him. We had him.
We had him. So good.
Yeah.
A
So
familiar theme throughout the beginning of the summer. We had a grant. We had a.
we have, and then we don't have. So we don't have, but we did have. And so that's the part that still hasn't been defined, but obviously is going to be a key element of this work. So
So, go ahead,
Sorry.
Harry.
Sorry. I'm sorry, Mr. Chair. Through you.
I was going to suggest that maybe Jackie or Jean could put up that document with those couple elements, the communities and the some proposed interviewers, so we can kind of look at that as we talk about it.
yeah, I can do that.
Okay. I'm sorry, Carrie, go ahead.
No, thank you. Jean, I just wondered if we could talk about the questions. I had a couple of questions about the information there, or if maybe you can tell me what the timing is on that. Maybe we don't have to talk about them yet.
Are you saying when this gets decided?
Yeah, so I had some questions about the example interview questions that are listed on here, and I wanted a little more information, but I didn't know if that's ahead of us or if this is the right time to raise it.
I thought what we wanted to focus in on were who would be the key informants,
Okay.
and then which communities would be the peer communities, and then maybe if you wanted to go back to that might be one way of doing it.
Okay.
But yeah, we definitely want to discuss it tonight so that we have, a clear view of what everybody's comfortable with going forward.
Okay, so that is a part of the discussion. That's all I'm asking. I'm trying to figure out if that's part of tonight or if
That's tonight.
it comes later.
that is-
Okay,
yeah.
thank you.
Yeah, because we haven't signed, the money's all set, but I've deliberately not signed a contract till these components of the work are agreed to by the board.
Got it. Thank you.
So the key informants, these are the interviews that MAPC will be conducting. And the goal here is to get 10 interviews, and they're saying Board of Health members, health director, which hopefully we'll have, we will have someone, whether it's our interim or a full-time by then, health department staff, public safety leaders, public service department head, that's me. I don't know if that really makes sense or not. Community-based organizations such as Walkable Reading and the Reading Coalition Against Substance Abuse, and then other public health officials from peer communities.
I have a couple of people that I would have liked to have seen on that. That being the public health nurses and someone from elder services. Does anybody object to that, or?
Oh, no.
No, that makes
No.
sense.
Can I ask a question? I always like to find out from the consumer what their opinion is. Can we put some vendors on here?
Vendors meaning like
Vendors
restaurant
like-
owners?
Restaurants around town, anything that's licensed that we inspect on a biannual basis.
Okay.
It could it could be random.
do we want to put school department?
I was thinking of that as well. Maybe, from the school or school nurses, someone along those lines.
I mean, I guess in general, anybody that was, to my way of thinking, anybody that was part of command needs to be on here.
And interesting. I mean, I know why I definitely want command, but I don't think we need to necessarily have all of the folks that were in command. Because that's a lot. I mean, that could be 10 just by itself. Depending on the day. So I
yeah,
think
we do-
that we throw all of the possibilities out and then think about kind of how do we pick?
Yeah, to pare it down. Yeah.
Yeah.
So- Can I also ask one quick question? Sorry, Carrie, to interrupt you.
No.
What put Walkable Reading on there? How do they interact with the board or the health department?
Good
I don't know
question.
where that came from. That-
Okay,
I
that
think
seemed like
there
an
was-
odd one to ask
think-
questions of.
The Reading Coalition Against Substance Abuse.
Yes,
is
for
the
sure.
natural, if you're
Yep.
going to
Yes,
do community-based organizations.
Yep, I
agreed.
agree.
Right.
Oh, sorry.
But
Um,
I don't think Walkable Reading needs to be there.
So I'm wondering if MAPC suggested that because the built environment is and public health access is a key component of social determinants of health, which is within our purview and the foundational public health services. And thinking about access. Frankly, I didn't even know there was a Walkable Reading. I'm fascinated to know, and that's
Pretty sure they got a Facebook page.
really.
I'm pretty sure. I
And
think,
did
I think that's how I get updates.
Is that
Motion, Reading in Motion, the DPH has funded a lot.
yeah, now is
around
that
that.
ACE and the folds and the walking groups? Is that somebody different?
I think they're one and the same.
Okay,
Not sure though. I'm not sure the answer to that question, Carrie.
okay. Oh, well, and yeah, okay, and Peter, I mean, if DPH is funding their activities, we ought to be aware and in concert.
So
Well, that
has
was
this-
a big, go ahead, I'm sorry.
I'm sorry, Peter. Gene, has this list just been generated by us and not shared yet with
Right.
folks doing it?
Correct. Yeah, we just,
Okay.
I took what they gave us and sent it to this board first.
Okay.
So this is from MAPC and we've added to it now. Okay,
So as I'm re-looking at it, we already have health department staff, so I'm presuming that includes the public health nurses.
so how many staff? So would it be Schwang? Do we do the part-time inspector? Do we do
Well, I think that's, from a process point,
right?
even the list they gave us far exceed. I mean, if we did all the board members and all the health department staff, and I mean, if we, kind of went through this, I mean, we're already exceeded 10.
Yep.
Right there. And so I wonder whether how we would make a decision on this.
Right.
I mean, I suppose one way would be to expand the scope for the same amount of money to 15, and
Mhm.
that actually won't solve the problem because there's even more than 15
That's
here.
right.
So that would be one way. And the other way would be to basically, take this list and prioritize it, create, this would be after the meeting, take the list, blow it up in terms of who might be at the school department or, and have the board members multi-vote. Like even the board members, there's 5 of us. And so that would be half of the feedback if we were going to, everybody was going to be included, and so
Yeah,
we probably, need to be selective. Jean, do you think that they would expand the number without much ado, or is that a issue?
I think that the budget will allow for 10 interviews. When I read this, I read it to be an interview would be like with the Board of Health would be with the group.
Oh,
One
Okay.
interview with a group of the volunteers, the health department
Yeah.
staff together. Maybe Elder Human Services could be with the staff, but
Yeah. Well, that would certainly allow a lot more input.
If I may, that was part of why I wanted to ask about the sort of the questions in the process, because what I was going to suggest is a couple things. So Jean, you're describing focus groups, which are structured a little differently than, right, the different kind of work and prep from key informant interviews, but a great way to get some more feedback. So I wondered if they would be able to do more of a mixed methods approach and do some key informant interviews, couple focus groups, and a survey, because I'd really like to see a quantitative aspect to this and have it not just be subjective qualitative data. And then my last piece was that I want to make, I'd like to know how they're going to frame this, because going and speak and asking folks, what are some strengths, what are some challenges, and what do you think the needs are, without a framing document of this is what a high performing public health department is, will just kind of perpetuate different people's perceptions. Will be again like the elephant that the wise man holds the nose and says an elephant is like a trunk, and the other one has the tail and says an elephant is this. And people don't know. People have very different perceptions depending on what communities they've worked with, depending on what experience they have. And I just want to make sure that there's also that guardrail to this. Maybe a chart with the foundational public health services, something simple. So that was why I was asking about questions, and that process piece. If they did include, if they were willing to add a couple focus groups, and talk to multiple nurses at the same time, that would be great. That's different. So I guess that's a lot of feedback.
I agree with you, Carrie. I think we do need a framework to work from.
Yeah.
Yeah, I'd like to make a third on that one. Carrie, I think you hit it spot on with these questions. Asking someone's opinion of a strength is asking their opinion of the strength. It doesn't give you actual data. Better questions are structurally formatted to say, how is your interactions with the health department? What is it on a daily basis, weekly basis, monthly basis? When you do interact with them, do you feel like things get done in a time? It needs to be more structured in that line of thinking to weed out that person's experience with the Board of Health, which is why I wanted to put a food establishment on there, because that's exactly what you want to get back to. How are the inspectors when they come in here? How do they handle themselves, conduct themselves, that kind of thing? Do you find that that it's easy to work with the department? So I think those are the better questions to be putting in here, rather than asking someone's opinion of something they may not know anything about.
Right. Well, and to build on that, Kevin, I think some of that then can totally be incorporated into a survey tool, and then we can kind of stratify our group and say, all right, it's really important to hear from all of these folks, but the second 10, can we survey them? The first 10 we want to interview, that kind of thing, and then you get more data.
Yeah.
I was interested, I agree about the vendor, and I was interested to hear from Peter, because I don't know if that's something that he's had experience with, or has any thought about having a business somehow represented in the process.
No, I haven't had any experience with this, but while I'm listening to this, take on a life of its own. I'm wondering if it makes sense that, you know, the interview begins with the Board of Health, and this is what we're talking about.
Mhm.
So then Mark leaves our interview or the Board of Health's interview with some structure on how to proceed through the other 9. And I
Good
mean,
idea.
getting folks from the community that we permit seems like a really sound idea to me.
Mhm.
I'm a little set back that no one's, I know we talked about command, but I mean, public safety,
Yeah.
the fire chief and police chief, I think are important perspectives.
Yes. Oh,
Yep.
absolutely.
So if Mark comes in and begins the interview with Board of Health members and we get all this stuff out on the table, then he knows how to proceed through the next 9.
Mhm.
And I don't know if that's pie in the sky or it can be done.
No, I kind of like that. Yeah,
No, I think it's a smart idea, Peter.
yeah.
Very good. Yep.
We just have to prepare him, and we probably shouldn't put anything else on much else on the agenda.
Yeah, I was gonna say, 'cause this could take off. I
Yeah.
mean, this could be a long while.
Yep.
Well, it'd be a special Board of Health meeting
Yeah.
that
Yep.
would be dedicated to the interview.
Yep.
And typically our meetings last from an hour and a half to, I think we've gone to 2 hours. You know, there's nothing in that contract, Gene, unless I missed it, that talks about how long the 10 interviews are going to take.
Uh-huh.
And maybe after hours, he can, you know, mix it up a little bit.
Yeah.
You know, some days you eat the bear, some days the bear eats you,
Yep.
type of thing. We'll take our share of it, and then he can kind of cut back on the other 9 somehow.
I like the idea of, the idea of focus groups or even group interviews, because you could get within 10, you could actually do a pretty extensive outreach if each of the interviews was actually a group of 5 or 6 people, like the board, or, like public health and school nursing, or the police and fire chief and someone else. So I think that could be fairly extensive. The other thing is we could suggest in terms of the survey, it might be that if they were willing to, draft the survey, maybe we could help them with the administrative task of distribution and collection,
Yep.
which would help offset some of their expenses. What we'd be asking them to do is to really put together the survey. The other thing I just want to mention is that I think very few people probably know what the Special Commission's report is. And so as a question, that's kind of, that's where you, as Carrie said, you need some background because people won't know what the Special Commission report said.
Truth. Mhm.
So
Yeah.
should we ask Mark to come back at our next meeting and have that to be a substantial chunk of the meeting time, is to, have this discussion, both our perspectives as well as what we'd like to see going forward. Maybe that's the next step.
Yeah, can I ask a clarifying question?
Sure.
Do we know if the subject matter expert is reviewing the questions in advance? Do we know if the subject matter expert is going to be part of the interviews or if Mark's going to do them? I just don't quite know the order or the progression, because that would impact our, we have to make, if the SME is participating, then they would need to come along too. Peter, you're laughing at me.
We don't have a subject matter expert yet.
There was a name at the end of this
Yeah.
document. I
Yeah,
don't know who that is, but
I do.
I do.
Okay.
Oh,
We
and
could-
actually, I have another subject. I have another candidate subject matter expert. Oh, I'm glad I remembered this. Yes, I have another one.
Besides David Napastik?
Yeah.
Okay, good.
How about Harold Cox?
Sure. I'm not sure you must know how to reach him and stuff.
Oh, yeah. He offered, so.
Ah. Well, he's probably more qualified than everybody.
Depending on the day, but yes, yeah. so I can add to the pool if it sounds like we're continuing to have the SME challenge. Okay.
Maybe we ought to add those, in getting back to Mark, maybe we ought to add those couple names and have him kind of think about that, or perhaps do some outreach and do some exploration before the next meeting.
Was it in addition to Harold Cox?
David, somebody?
Oh, Napostic. Dave Napostic is, he's a good guy. He was in Newton, and he does some consulting out there, but yeah, he was president of MHOA. So was Steve. I mean, I don't have a problem with Steve either.
No.
But the preliminary work could carry on. And my suggestion right now, and I'm watching body language from Gene, is to let us handle all this conversation administratively with Mark. We can share with him what this discussion that's gone on for 20 minutes or so already entailed, so he can, kind of prepare. We might have to do this again before we have the interview. I don't know.
Can I mention on the cities and towns, the peer communities? There's reference that they were based on demographics and population and so forth, which is fine. But I would think more importantly, or as important, because you have to start there, but as important would be which of these communities is viewed as having a high functioning health department. And, because the communities are the same size or demographics or whatever, they could have a health department that is not functioning well. And we certainly do not want to model after that. And there's, I kind of did a little bit of search on the internet, but it doesn't seem like there's any performance measures of the 351 health departments in the Commonwealth that you could actually, just like we do for hospitals, they have Medicare produces quality reports, for large health systems, there are quality reports and you could kind of see how well those entities are performing. Does anything exist like that for health departments, or would this be a word of mouth kind of gut feeling?
Yeah, no, there's not anything currently. And that's actually kind of a can of worms because of some of the co-equal powers for municipalities and states and the state authority. But I agree. I mean, I looked at that list and I can tell you a couple that I'm less interested in, and two that I think would be important to have on based on my experience. One I know is applying for accreditation right now, and I think that, so it's not just my experience, but they are striving toward accreditation, so they're a good one. But yeah, I agree, Rick. It's a little some more data about how those hit are useful, and I'm happy to tell you my preferences and feedback.
Well, I think, probably Peter and Carrie may have the most knowledge of on the ground of these communities, who's highly regarded. And those would be the ones I'd want to go with, given that they're all otherwise demographically and population wise similar. Peter, you had a comment?
Yeah, I was just going to chime in and state that typically they rank it by, the budget for the health department and the personnel. So just because the demographics are similar, and if to your point, Rick, there really isn't a standard the way you were describing hospitals, but if you could find somebody that has a health budget that was similar and the same staffing level, then that would be comparing apples to apples.
With the caveat that you have to remember that you'd want to be looking at what is the actual, what is municipally funded versus what is grant funded, and which of the staff are grant funded and which are town funded. Because I know
Lexington?
No. I would not put Lexington on my list. I would put Needham, but they do have a fair amount of grant funding. So their head count, you might rule them out if you didn't, do a little digging, because they are bigger. But what's funded by the town versus what they've gone out and sought funding for, I think that's an important distinction, sort of that base level.
Yep.
Makes sense.
Yes.
Right. But I would say that if a particular town, had 50% of their staff grant funded, 50% town funded, yet that staffing, that 100% of staffing was recognized as performing really well.
Yeah.
I think the budgeting piece would be interesting to know, but with respect to us trying to create a vision of where we want the health department here to go, we would say, well, they have 6 people, and that model, regardless of how it's funded, seems to be the model we have to
Right.
get to one way or the other.
Right.
In an effort to rule out, perhaps, now you said Lexington would not be on your list, Carrie?
Not on my list, no.
Okay, if I recall correctly, when we were discussing doing the alliance, Linfield was currently being, their public health department was there with fire or policeman chief?
Yeah.
rather.
Right,
So
so maybe we take them.
That kind of rules that one out, I would
Yeah.
think.
Yep.
So we're weeding some out, I guess.
So Carrie, you said there were a couple. Needham was one. What was the other one?
I was looking at Bedford. Bedford, I'm interested in. And I'd say Burlington and maybe Burlington, maybe Canton. And I don't know enough about Danvers, so I have blind spots, but I think we know somebody who knows something about it.
Yeah. I
Peter,
did.
who would you, which of these health departments has a good reputation, in terms of performance?
I could say Swampscott has trash collection under their health department. So they budgeted for the weekly pickup of curbside solid waste. And so that wouldn't be a fair community.
Right.
But Danvers is close.
Okay.
I mean, it was, I'm not sure of 2 years gone
Right.
by what's happened, but I don't
Right.
imagine it could have gotten too far off the track. So, and I really, I mean, it's hard to judge until you see what they're doing. And some,
Yep.
if animal control is a big deal. And if they don't do animal control in the health department, or to what extent, then we're not going to get apples to apples.
Right.
And so I
Yes.
don't know.
I was just a Dedham, maybe just because they have such a high amount of restaurants. They have a lot of that feels like they aren't necessarily a fair comparison. They're so busy. Yeah, I mean, and that makes sense. Norfolk and Westwood seem a little bit closer to
In terms of comparison, they have a prison down there.
in.
Norfolk.
Norfolk.
Oh, okay.
So I don't know if that would rule them out in terms of comparison. I mean, not that many communities have prisons, but
Right.
I don't think that would tilt anything. I mean,
you don't think.
Middleton
so?
has a prison. Danvers never got involved with
Right.
Middleton Jail. But let's look at the list right now. We have 5.
Yep.
And we could beat ourselves up
Yeah.
trying to find a 6th, and then we have to beat ourselves up further
So,
to
I
eliminate.
thought we only needed 4.
Right.
Oh,
We're
right.
looking for
I'm sorry.
four, so we're good. So how do we, so in terms of wrapping this up, what we're saying is that Jean and Peter are going to go back to Mark, convey the nature of this discussion around the 10 interviews perhaps being more in groups or focus groups, that we had some concerns about some of the questions, that we're interested in potentially a survey to give us more quantitative information, that there's a couple people on the expert list that we want to run by them, and see who's available in that short list, and that we identified some of the towns that we're more interested in comparing, and then have them come back. Hopefully, they would have solutions or responses or suggestions about all of those things that they could come back to us on.
And
Is that-
were you thinking that we'd have an interim meeting between now and our next one with them? Or wait until after the next one? I'm just thinking in terms of the timeline that we've been talking about, that sort of pushes things off.
Right. We could, I guess what I'd ask is for Peter and Jean to have that conversation in the next few days and see if, having a meeting would be the first Thursday of August as just on this topic, whether it's something that after that discussion, you think we should go ahead.
Could I offer one more thing? I'm sorry.
Go ahead.
I was going to just try to keep it simple and say time is on our side at this point. The more administrative work we do back and forth with our contractor, the MAPC, that's not billable hours. We're still working this out. And then, so maybe we come back next month and offer something similar to what we see tonight, except revised. And we can have another chat. And then, maybe it's not until September they show up here for the first interview session. And who knows by then what the status is with the health director, which I think is something that should be spinning in the same orbit, maybe at a different speed, but I think it would be advantageous to have the person whoever it's going to be here and part of it. It would be, I don't know if it would be a good idea to have someone come walking in the middle of a survey and say, gosh, I wish I knew, I wish I were a part of this from the beginning. A little bit of ownership, and we're that close, perhaps.
I know you were saying that the board would be doing the surveys, but one thought along Peter's line of thinking is if we're going to be getting a new health director, hopefully around the same time that we're doing this work, the health director will be brand new. Would it make sense for the health director to have a role here, whether it's administering a survey or collecting feedback or whatever? The health director is brand new with a brand new set of eyes and ears, talking to people, however that plays in here.
Yeah,
Yeah.
I mean, I think that, this is sort of the next agenda item, but, we have started the interview process and there are a couple strong candidates. And so I think Jean and Peter are both sort of echoing that, a new health director could be sooner rather than later, and in which case, having that person more involved in this whole process could be useful. Therefore, not necessarily rushing it or trying to put closure on, the process before a potential new health director comes on board would necessarily be in our advantage, particularly since we're not paying billable hours right now.
I think people's availability is better in September. I mean, everybody's going to be vacationing, July and August, tough months to get people.
Yeah.
Yep.
Okay,
I mean,
well,
it's very easy to create a survey tool using SurveyMonkey and very easy to administer. And, you know, that's not a bad way to, you know, you talk about doing it, having the new director, you know, involved, engaged and have some input, or, you know, design the survey and share it back and then get to have the analysis. It's easy to do. So, you know, maybe that, I see Peter saying maybe not, that's their thing, but, yeah, so, okay.
Yeah, we do surveys all the time, even if the new person needs a little bit of help in some way. We've done tons of surveys, so
Yeah.
we can support.
And that's great, because I think that a little quantitative aspect to balance out that, all that qualitative is really useful and important. Otherwise it's, I don't know, it's too subjective. You know how I
Yep.
feel about subjective.
no, that's a good point. It's a really good point. Okay, so,
Thank you
plan-
both.
So I think the plan is Peter and Jean will go back, have more discussions, perhaps, you know, come back at our next meeting with, you know, the output of those discussions and, you know, what Mark is recommending. And we can talk about it more and, you know, maybe meet with Mark in September to finalize the process.
And we'll have the SME at that point, hopefully, as well.
That's right.
Sounds good.
Sounds good. All right, Jean, you want to give us an update on the health director position recruitment process?
Nice segue.
That's it right there.
Nice segue.
That's it. There is a search, right?
Yes, and thank you all for the excellent questions. It was really a big help and a big part of the process. So I don't know exactly which ones made it and which ones didn't, but there were a lot in there. So thanks. So yes, we did have the first interviews. Peter, myself, Rick, a couple public safety folks, and a few others were in the first interviews. And so the second interviews was a different group. I was not part of that group. I don't think Rick or Peter were either. So it's a second group doing the second interviews. And yeah, we should know hopefully soon.
And, you know, what's reassuring is that the candidates, you know, do have strong backgrounds in public health and experience. And, you know, we're not, you know, there were some candidates who applied that were like PhD epidemiologists, had no experience at all in public health. You know, but the ones we interviewed were solid. I would feel pretty comfortable, frankly, with either one. And so hopefully we're encouraged that, you know, it could be sooner. We were concerned that it could be 6 months, but, you know, it could be a lot sooner than that.
Great.
Great to hear. Thanks
great.
for all the work.
Yeah.
Again, thanks for those.
And thanks for being so gracious about my questions that arrived at 11 o'clock on
No
night
problem.
before.
No problem. I mean, again, I think the stars lined up for us. I hope they remain that way. We've had some pretty good fortune over the last few months, and some of it has, you know, panned out, but we weren't able to exercise it. I think we got some good fortune coming this way. We have some folks that we'll be happy with, I'm sure.
That's great.
Good. All right, Kevin, the coalition, thank you for that 40-page update. Very detailed.
Yeah, very detailed. Yeah, so I just
Comprehensive.
I wanted to send that out just again to try to give you the information rather than try to go through it all with you.
Sure.
Some of it's relevant to the board. I don't necessarily know that all of it is, but one of the things I always find relevant is the Crisis Intervention Team. That's their CIT program. This is the one where when the police get these calls, they can refer them out to the coalition to get some outreach and get some help in that way. And it's been up and running, I want to say January 2020 is when they first started. So we don't have unfortunately, a ton of data year over year, COVID year this year. It's all basically been COVID year for them. But they definitely have felt that those calls have been up. So I think that's kind of the obvious elephant in the room, right? This is still on pace for September to do the 2021 YRBS report. So that'll be coming out there presenting to the school board then. And then there's also I hadn't heard of this one before. They call it SBIRT. The statewide program for student substance abuse is underway for the 2021-2022 to get ready for screening. So they do screening in the schools with the nurses
Every year.
every year. Yeah.
Yeah.
So they're kind of preparing for that right now. So that could be, something in the fall, some very interesting information to report back to you about. So just keep you informed as that goes along. The social worker position is they're still currently working on the description. I feel like this was just thrown in their lap so quickly that they were just like, okay, what are we doing here? So they're I won't say they're slow playing it, but they're cautiously going about it. And I think it's the right move. They're talking to peer communities that have this like position to try to get a better understanding about what it is we want this position to end up looking like. So that really doesn't have much of an update. That's still underway. And then the only last piece was on there. They had the William Jane College Interface Referral Service. They just had some data in there you can look at. It was compiled from 2016 to 2021. So I did ask Sammy Sulkin, who is, as of what day is today? I think as of today is no longer officially an employee in the town of Reading. Unfortunately for us, she is moving on to get her master's down in North Carolina. So congrats to Sammy for that. But she did say she'll pass along to Erica, because I was just curious to see, do you have any last data over the last year as opposed to just all kind of lumped in? Just as a curiosity peek to look into, what are you seeing on that level as well too. So I will hopefully have that information for you at the next meeting that we have. And that's about it. The rest you can read at your leisure. Some really good information in there. I know that their annual meeting is coming up fairly soon. That's listed in there as well too. The date is escaping me right now.
September 29th.
Thank you. I was just about to look for it. Good job. That's all I have.
That's great.
Great.
Thank you, Kevin.
Thank you, Kevin.
Welcome.
This just speaks to how important this is.
Yep.
Even become even more so since COVID.
Okay, Peter, the monthly report, we have a number of items in that.
Yeah, we're going to have to pace ourselves through this monthly report, but before I put it up here, I'll just say I was at the send-off reception today and had a chance to talk to Erica. Thanks, Sammy, for being here. They had nice things to say about us and Kevin particularly. And I'm pretty sure that Erica has something to do with the, interviewing second round. So the candidates right away are getting in line. I would also state, I hope I can say this, Gene, put up your hand if it's that the police chief asked both candidates if they would mind being part of the process and identifying, what we want and helping with the hiring of that social worker that we were just talking about. So we're getting connected at the hip. Last time we were meeting, I said, I want to be at that table.
Yes.
And I think I didn't have to go much further banging heads. So, okay, now we can go to the monthly update. And I guess I'll share the screen here and go with that. Can you see it?
Yes.
Maybe it's.
Yep.
open that like that. So let's begin with Christine, please. She's going to take parts 1 and 2 under epidemiology. And Christine, you're still with us, I hope.
Yes, I am. Yes.
Good.
Hello, good evening.
Hi, Christine.
Hello. So with regards to COVID, data is based on Maven reporting and subject to change. This report was run over the past 14 days or from the beginning of the month to today's date. The total case count is 1,925. At the present time, there is only one active case, which is very nice to see. Yes, transferred cases remain at 10, deaths 49, and recovered 1,864. At the present time, there are no clusters. And with regards to civics and recreation, I had the opportunity to speak with Jenna from the rec department this week. The reason for our conversation was that one of the campers came down with some cold-like symptoms. They have a pretty solid COVID compliance protocol that they follow, which requires medical clearance to return. And the discussion that we had, it was to just make sure that part of the testing that is done is a PCR and not an antigen test for COVID. So she did go ahead and update the protocol just to make it a little bit more clear.
Great.
Yeah, I thought that was good. Excuse me. With regards to Camp Rice Moody, which is the Girl Scout camp, I received a call last Sunday, and it was from the camp manager who reported one positive case of one of the campers who does not reside in the town of Reading. I did speak to the Department of Public Health and the public health nurse from the town where the positive case came from. I've also been in several discussions with Joanna and plan to speak with her again tomorrow morning just to check in, make sure that no other campers, have tested positive, and that she is following the COVID compliance protocol that she presented to the health department when we inspected. And that includes the review of sanitation and methods to disinfect. And with regards to other communicable diseases, there was one Hep B and one Hep C, and both were chronic, so not acute.
Well,
Any questions then for Christine about this? It was a good month in that things have slowed, right down to a crawl here. But I know full well that on Sundays she gets the call, she answers the call, and we get busy right away.
Oh.
And also right down to the nitty gritty with these different types of testing, we found, one is better than another, and make sure that rec is doing, what's best. I suppose I could lace in, you'll hear later that the camp was inspected indeed. And the nurses were there, the sanitarians were there, and we went through all that. So, we weren't caught with our pants down, so to speak. Actually, everything worked the way it was supposed to, and that's what we're here for.
Right.
So if you have questions for Christine, though.
It's good.
No,
One case.
good job.
I just have
Thank you.
one small question, because you know how I do.
I'd have been disappointed, Carrie, come on.
Christine,
It's
it's
Carrie being Carrie.
It's Carrie being
That's
Carrie.
okay.
I'm just curious, Christine, when you talk about, that great number of folks that are recovered, it's wonderful. Do you have any information, anecdotal or otherwise, about if any of those folks are or have experienced long COVID? I'm just wondering, what kind of if everybody recovered, smoothly and easily and was back in action in a month, or if they're wondering about the prevalence of long COVID in the community.
Yeah. So that has just been brought up by Scott Tropy and Hillary Johnson. I think you know who they are with the Department of Public Health. It is something that they are looking into and pulling together data. And I do believe that there will be more information in the near future. The other topic that they're looking into, and I think we may have touched upon it last Board of Health meeting, was the variants. And
Yes.
yeah, and I know right now, in particular, the Delta, and a few other things just with regards to vaccine for children, for underage. So I feel like the state, excuse me, they've done an excellent job with keeping, I had a conversation with one of the public health nurses from Wilmington, and if it were not for the state, in particular, Scott and Hillary, with their weekly meetings, and they continue to do that every Tuesday, I feel like the local boards of health, I don't want to say would have been lost, but they helped huge.
Yeah, it's a very I'm not sure, I'm losing the word, but it's definitely a connected relationship. And I know through COVID, they really were working hard supporting public health nurses. And happy to do so, so, but okay, I'm glad to know that somebody's following, that that there is some follow-up. I know that's not something that, certainly it's not something you were asking intake.
And
so.
if could I just make one more comment in that, I know that testing has gone down. There's not been a great deal of testing, probably because it is summer. I don't want to predict that in the fall that cases will go up, but I do think, if the schools are going to continue to do some of the testing that they did last year with the antigen test, we'll probably see some cases at that point go up.
Yep. Yeah. We're enjoying the quiet, but
yes.
not there I use the Q word, but nobody's complacent yet. So
Not even close.
nope.
And just for FYI, I know that MGH is doing a study on the Moderna vaccine for 6 months to 12 years.
Oh, good. Oh, that's great. Yeah.
Thank you.
All of that could have been a segue. I don't mean to be rushing things here, but
no, it's a segue.
the next topic is the vaccine programs. Before I introduce Schwung, I'll point out that further down the list is some more red, and her report today will also cover some website stuff and some foundations stuff that come under a different category. So Rick, if it's okay, we'll kind of skip around.
Sure, go ahead.
All right, then Schwung, you're ready. And I don't know if I have to stop sharing this so you can put yours up, but somebody coach me here and I'll do it.
Yeah, sure. If you want to just click stop and
I got it.
Thank you. Okay, can you see my screen about the vaccination ready?
Yes.
Okay, great. So yeah, since last meeting, our Reading vaccination data has not changed a lot. We got 2 people coming and get their JJ vaccine. So the fully vaccinated individuals from our clinic is 569. And the data from MassGov on July 8th, we have 17,827 individuals are fully vaccinated in Reading. So it's about 65% of the population age 12 plus. And we now have 35 doses of Johnson & Johnson vaccine left. This one is the screenshot from our department website. So every Tuesday morning from 10 to 12, I'm in the Pleasant Street Senior Center, and people can come in and get their JJ vaccine. And I also leave a phone number, then they can call if they want to make appointments. Okay, before I move to the PowerPoint, do you have any question about the vaccination? Okay.
Can I ask,
Sure.
has there been any decision made in the school system about mandatory vaccinations for the fall, or are they waiting from DESE, or how is that? Does anyone know how that's working out?
That would have to come from Desi, yeah.
Okay.
Well, I could reach out to Mary Juliana and see if you wanted that information, and I could share it.
I'm sure that there has to be some announcement right before school starts. I was just wondering whether it already.
Yeah.
That's okay.
Sure. Yeah, we can update that information in our next meeting.
Okay, that's good.
Yeah. Can you see the PowerPoint monthly updates on the
Yes.
screen?
Yep.
So yes, I have a couple of topics to talk today. That's medical waste, especially the shop containers, medical supply inventory, and camp inspections, website updates, and the foundation public health course. So regarding the medical waste shop containers, we have a contract, the Department of Public Works have a contract with Stericycle. That's the company who come and pick up the shops. So in Reading, we have 3 sites. They are police department, fire department, and town hall. At police department, Stericycle come and pick up the shops once a week. And for fire department and town hall, we are on an as-needed base schedule. So it means if we have shops, then we can call Stericycle customer service and they will come to pick up. Their pickup service have a weight limitation. It's less than 50 pounds. If it's more than 50 pounds for one service, they will charge for overweight fee. So in Reading, the contact personnel, including Jane Casilla, she's the director of Department of Public Works, and myself.
Excuse me, before you go to the next slide. Yeah, you know, when I got here, and Daniel's right here with us. I'm not going to ask him for a comment, but this whole business of medical waste was, nobody knew exactly what was going on with this. And I would say that in the short time Shuang's been here doing full-time work as our public health nurse, she's pulled all this stuff together. So it's in a tight little bundle, as they call it, and we know exactly what's cooking. So thanks. That's important stuff.
Very important. Thank you very much.
Jean?
You're welcome.
I just want to emphasize, we are really encouraging people to not drop off medical waste at town hall. And we prefer that everyone goes to the police department with the container, and we want to steer it that way.
Yes.
So
Yeah.
I know as a practice in the past, we had picked up at town hall, but we're really not set up for handling medical waste. And that container at the police station works very nicely.
Yes, and the police station has, once a week pickup schedule. so it will be more convenient for the Stericycle to go there. And their sharp container, I mean the bin, is located in just right in the entry of the police department. Okay, next. So just some updates about our medical supply inventory. We have the sources, from Stericycle, they provide us the sharps, and Sanofi, we order flu vaccines and some other medical supplies, as well as the Mackensen. So this screenshot is from the medical supply inventory Excel that we currently have these supplies on hand. So we have like alcohol perp, bandage, needles, and the sharp containers. So I'm keeping track with this, record, and we'll update when we receive any new supplies.
Excellent. Those
Yeah,
things
again,
make my heart so happy.
Yeah, just took my 2 cents worth, and I have a hard time keeping my mouth shut, as you know by now. But this is very well managed right now too. Especially, we want to keep the supplies minimally, so that if we are finding ourselves in the middle of a move, we're not trucking along, tons of equipment along the way between town hall and the police station. And so that's important to note too. But I hope you're getting the idea that we're really organized thanks to Schwung so far. It's good.
Okay, thank you. The next one is camp inspections. So so for these weeks, Christine, Dan, and I are doing the camp inspection. We follow the community sanitation program that's from Department of Public Health. So we typically inspect their permits, camp policy and plans, staff qualification, medical policies, and records. We have inspected 3 camps so far: Camp Moody, YMCA, and Elliott Field Hockey. That's right now in Austin Preparation School. They all passed the inspection with no violation. Do you have any questions on that? Okay. So website updates. We talked about the mosquito control in our previous meeting. So this page has been updated. I'm just gonna quickly share you. Oh, okay, can you see our town website?
Yes.
Yes.
So it's located in Department and Public Health Service. You can find it on the left side, the mosquito control. So it includes the exclusion form. You can find over, by click this link, it brings you to Mass.gov, the exclusion form, then people can fill out, and then they don't get sprayed. We also have information about pesticides, mosquito-borne disease information. And for our animal control, it's on a draft. So let me just give me 1 second and pull it out. Okay.
While we have this little pause here, I asked Schwung to concentrate on animal control because that's in flux right now, and maybe as soon as she's done with this piece, I'll skip around a little bit myself and go down to where we are with animal control back in our monthly update.
Sure. Yeah. So can you see my animal control watch?
Yeah.
Sure.
Yep.
So yeah, we will let the public know that any animal control issues need attention to be reported to police dispatch, then who will assign accordingly. And we also have some information from our Reading general bylaw about the license. So, you know, all dog license expired annually on December 31st. And people should get their license by March 31st. Otherwise, they will receive a fine. And we also have some kennel license, like instructions that how they can get that. So the town clerk is in charge of the issuing the license. We also have the general bylaw link that it's under the article 8.8, so people can find the animal control bylaw from this link. And we also have other information regarding the regulation for the keeping of animals. Do you have any question about our web page draft?
Nope, that's great.
Okay.
All good stuff.
Sure, thank you. And the last thing is, I believe it's the foundational course.
Before we get to foundation, let me carry on
Sure.
a moment on animals. We don't have to revisit it.
Okay.
So when we got here, there was no animal control for a while. It had been under police, and we were sharing services with another community. I mean, it's almost a seasonal type of service, but you know, we were making it work with the patchwork the way, you know, local communities do it. And I found the woman who used to work with me in Danvers, asked her if she might be available, and we tried her for a while, but she just wasn't working out too well. But we have somebody now. I mean, Bob was approached by the town manager in, let's see, where was it, Gene? The town manager in Wakefield, and he had a full service of folks who actually worked in Danvers too. And so Bob and Steve from Wakefield came up with an idea where we could share those services. So this has brought us up to being more prepared. And we met with the police chief and the town clerk, because this business with animals is kind of complex. You license your dogs through the town clerk. The police have a role in it too. I mean, with the enforcement issues, obviously. And then health has a role in it too, with the quarantine of animals that bite or come home with wounds of unknown origin. And so trying to figure this out between the three departments is, you know, still underway, but we're a lot closer than we were just a couple of months ago. And I'm pleased to report out on that.
Great.
So I guess, let's see, Selectman Bachi has a hand up through you, Rick.
Go ahead. Go ahead, Carlos.
Are you on mute?
Me?
No, Mr. Bachi.
Can you hear me now?
Yes.
Okay, sorry about that. Is you mentioned Wakefield, which I think is a positive, but is that in the works or is that being worked out? It sounded like it's going on now a little bit.
It's actually, it is going on now. I've sent 3 dog bites to this. It's a couple that work together, husband and wife team, who are working for Danvers and Wakefield. Bob is working out the details with the town manager. I'm not sure where it is in the process, but I think it's gotten to at least somewhere on how we're going to get, how these people are going to get paid.
Right. That's why I was asking. Okay,
Yep.
thank you.
Yes, sure. That was an easy one. Thank you. Okay, swung back to you on the foundations. And Kerry, this is, this is about you, so stick with it.
Sure. So the foundation for local public health practice, this is the course link. So on the webpage, you will see a red button. It says enroll. And I'll just quickly go through like how you get onto the trainings. So you click the enroll button and then you can register or log in to your account. You will see a like blue colored word. It says Foundations for Local Public Health Practice. And you click on that, then you will see all the trainings. So there are about 27 trainings in total, including the final topics. And they are separate to 4 parts. Introduction, legal and administrative matters, environmental health, community and population health. And after you complete the last final topics and the scores are above, 80% or higher, then you will receive a certification, and which means you complete the courses.
So this was a plan from a few months ago when we waited till July 1st. Schwung was on it on July 5th, I think it was. And, you know, Paula, you and I have spoken about this and you expressed a potential interest. Daniel has taken out of the 27 course, I guess you call them 27 modules. He's done more than half. And so he's out straight right now. You'll get more of that as we move along. But so we're going to let Schwung get started. And by then, Daniel will catch up and hook in rather in a few weeks. But I'd like to see the deadline of completing this to be the first week in September. So I asked Schwung to kind of back our way into it on how many hours is this going to take per week to get the 27 modules done. And then I will invite anybody on the board if they would like to sit in. Schwung said she'd be agreeable to, form a study group if you'd like, and we can do something like that right out of town hall and work together on it. I'm not sure how it would work out, but I think that's, probably a little motivational technique to get folks going. So you can talk to Schwung, anyone on the board who is interested in doing this. And it would be a good idea. What the heck?
Yeah.
We're all on the same page moving forward. And I think this is
And
all
this is
helpful
free,
in development.
correct?
Yes,
Yes,
absolutely.
it's
It's free.
Yeah. Yeah, let me know if you need help.
May
Okay.
may I?
Sure.
Yeah, go, Carrie.
Thank you, Schwung. You did a fabulous job summarizing. Thank you, Peter. And some of you know, so the Foundations is actually a product that was produced out of the Local Public Health Institute, which is the program I manage currently. And the Foundations course used to be available in person, but now it's all fully online as of July 1. And I love that you're extending the deadline like that, Peter. It's about a 35-hour commitment we found for folks to take it. So
What happened?
out over the weeks, I think is a great idea. And this for those who don't know, so this Foundations course is part of the Special Commission report on local public health, and recommended that every member of the public health workforce have taken this course as a basic minimum training standard. That's included in the legislation that was signed by Governor Baker last spring. It has not yet been funded to support that. So while the course is free, it does require that towns set aside time to have their employees take it. And I'm thrilled that you all are doing this, and I look forward to hearing feedback about it. And I'd love to join a study group.
I think you wrote some of these modules, if not all of them, Carrie.
No,
so-
no, not all of them, but I did write a few, and I've
Oh,
reviewed.
okay.
I've reviewed a lot. But my my immediate supervisor, Kathleen McFerris, wrote many of them. And Peter knows Kathleen. She has a lot of experience in Massachusetts and nationally. So they're good. I hope y'all enjoy them.
And it's your signature on the certificates at the end, is it not?
It is, Daniel. It is
Good
my
plug.
signature. Yep.
Good plug on that, Daniel. This is all part of our staff development
Great.
plan. That's part of our monthly update. So anything else for Schwung? And I think that's your last topic, Schwung.
Yeah, that's my last topic. Any
Okay.
questions?
No, thank you.
Just
and
thank you.
Christine,
Yeah.
Thank you both,
Thank-
both very much.
Thank you so much. My pleasure.
Okay, so now here we are back at the monthly update. I'm going to skip right along here with and the data for our inspections. You know, we just began with the list, but I've got to say Daniel is on top of it. He sent the list out promptly on July 1st to our 2 contracted inspectors, Dennis and all right, and another guy who works in Saugus too, John. And, you know, Dennis is sending in his reports as he's doing them, but John was asked to deliver them once a month, so we're not seeing what he's done so far. So here is just the running, you know, the inspections. 6. That doesn't seem like a big deal. I don't know what the total inspections is, 6, but Dennis did 9. Dan did 3 pools, 6. I mean, maybe Daniel would be better at explaining these because I'm a little confused right now on this page right here.
Yep. So
Go ahead.
the 6 was a typo from an earlier version of this.
Oh, is it?
Dennis completed 9 food establishment inspections. I completed 6 food establishment inspections. And in addition to that, 3 pool inspections. There was nowhere else on the report to put that,
Okay.
unfortunately. So in total, in that area, 18 inspections have been done, plus however many John has done. We won't know until the end of the month.
Yeah, thanks a lot, Daniel. Stay tuned on this one because walk us down now through the complaints. And we might have to jump again down because I do have a listing down here on what occurred Tuesday night here at on Main Street. And so that's not going to show up because it was on the month before we got complaints. But here's the list of the complaints as best we can gather for the time being. And we did have 3 animal bites. I mentioned that, but no complaints on animals or body art or drinking water, camps. I guess really goes down to we have 1 complaint outstanding still on noise. And that's going to be an interesting one. Maybe the details will be forthcoming for next month, but we're working on that. Pests, both of these complaints right here were due to rodent sightings in neighborhoods. So there were only 2 for this month. And, you know, we're fortunate. We might have passed the big breeding season, but 2 rat complaints in 1 month is not many.
Yeah.
So we're fortunate about that.
Yeah.
Any questions about the inspections that we've done?
Peter, just for completeness sake, you might, for the next month's report, we might add under other environmental domains in that long list.
Yeah.
Pools.
Right.
Yeah. 'Cause,
Okay, instead of complaints, they could be okay, there,
well,
I
there's
see
a
inspections
column for
right there.
inspections, yeah.
Yeah, right.
I will caution you folks just because just the other day, I believe it was just this morning, I completed the reinspection for our last pool that needed to be licensed. So that number will not increase until next year. In all
Well, we can still put it
We'll
in
be
there and watch it sit still for a year, Daniel, thanks.
We'll be ready.
Okay, so under food, while we're on the topic, you have 2 proposals in front of you for, the first one is going to be an amendment to our grease trap regulation. And I'm going to let Daniel take over with both that and the intro for the second one, which was the risk-based inspection procedure, will come next. But Daniel, can you take the grease traps? Do you have that? Oh, you can't share a screen.
I cannot.
Yes, right. So have you read the proposed amendments for the grease traps?
Yeah.
And I'm looking
Yes.
at the body language from the board. And are there any objections to what we're proposing, which I'll quickly summarize? The current regulation, which was put in place, I think it was in 2005, asks restaurants or anybody that has a 3-compartment sink and thus a grease trap beneath it to do a monthly report, inspect it and pump it every month, which is too frequent. They don't need to be pumped every month. And we got feedback right away from many of these establishments saying, you know, that's an added expense. Come on. And looking at some of the other cities and towns, and Daniel did a good job of finding them, you know, everybody's doing it quarterly. And I think that's a more prudent request of our food establishments. So that would be the first piece. And, you know, nowhere in our existing regulation was there language on, you know, zip that into us on a quarterly basis so that we can compile it here in our own notes. And the reason this is important, it's important for the entire infrastructure of the town. And people don't think of wastewater every day unless it doesn't disappear when they want it to. But we heard early on from DPW that they'd like to know, you know, how much grease is being generated in our food establishments. And that's exactly why this local bylaw exists. Or it's not a bylaw, it's a public health regulation. And the only thing is we weren't tracking it, and it's not uncommon. We didn't do it in Danvers for many years because it was labor intense. But now it's simple, at least from our end. We don't have to open, you know, the 4 nuts and pop this disgusting piece of infrastructure within the restaurants open. They stink, and clean it on a quarterly basis. But as far as them sending it to us and us compiling it, it has got simpler with, you know, with the technology that we now have. So that's the overview. If you don't mind, discuss it, and then we will see if we can amend it. Turn it back over to Rick.
I would just, you know, I read through it and it looks like it was very helpful to see those other cities and towns and their comparative. And this is sort of lines up with them, and it makes a lot of sense in terms of convenience for the establishments, as well as, you know, still maintaining public safety. So, and public health. So, you know, I'm very comfortable with the recommended changes. And anyone else who has comments?
No, it made sense to me as well.
Nope, made sense.
Sorry,
Oh, sorry.
cutting somebody off. I agree, it makes sense. And I just want to say, I really liked the way, to echo what you said, Rick, I really liked the way that this was presented to us. And I would hope that that would be a standard for how information gets given to us. It's great to provide the context, provide some good comparisons, provide the details of what the changes are, and the attention to process and sort of making it clean and clear is wonderful. So,
Yep, makes our job easy.
Yep.
Yeah, excellent job.
That's the point, and we can all thank Daniel. He takes instructions and carries them to the next level. It's wonderful.
Great.
Thank you, Daniel.
Great job, Dan.
Yeah, thank you
Thank
then.
you.
Thanks, Daniel.
Peter, do we have to take a formal vote on this?
Yes, sorry, Rick,
Yeah,
that's
we do.
why I turned it over to you
Right.
for further
So-
discussion, and then, yeah, we'll need a vote.
So if there's no further discussion, I would make a motion to approve the recommended changes to public health regulation 24.5 as presented tonight. Do I have a second?
Sure, Paula.
Paula?
Thank you.
Second. Okay, roll call. Carrie,
Yes.
Paula,
Yes.
Rick, yes.
Thank you very much, folks. Okay, so now we'll move quickly to this one's something we could probably relate to a little easier, and it has to do with risk-based inspection procedures. And I'm just going to turn it right over to Daniel, because again, I think you'll be pleased with what he has to say and show us. starting now, but Schwang, were you gonna put this up for us, please? I gotta stop, don't I? Stop the share.
Yes. Give me 1 second.
Sorry.
Yeah.
Dana, you have any remarks while she's getting it ready, or
Okay.
you know how much I hate silence, silent air. We pay big bucks for this time.
I'm done. I'm done.
Okay.
Dead
Oh,
air,
here we go.
dead
Here
air.
we go. Here we go.
Yeah. Then
All right.
when you want the next slide, just say next. Thank you.
Will do, and I appreciate it, Sean.
Oh, no problem.
So let's start with next slide, please.
Sure.
Right. So just a bit of background. I'm sure this might be old news to you folks, but food-based infections are probably one of the most common problems that we have to deal with in public health. According to a 2011 estimate, CDC believes that 1 in 6 individuals in the US will become sick as a result of a foodborne illness. And most of those can be traced to only about 31 specific pathogens, and they're fairly common in our environment, restaurants and water. These are typically harmless, if a little inconvenient, but among our most vulnerable populations, children, the elderly, they can be quite serious. Next slide, please. So the good news here is that a lot of these pathogens can actually be prevented with things such as proper food storage, cooking food to the proper temperature for the proper amount of time, and of course, diligent and thorough hand washing by food establishment staff. So all of these things are things that we monitor and track whenever we conduct food inspections. Next slide, please. However, right now, we only inspect food establishments twice annually. That's the standard that's recommended by some of the older food codes. However, in the 2013 food code moving forward, which is the one that Massachusetts has now adopted, they also have recommendations for what they call risk-based inspections. And those weigh each establishment by how risky it is in generating these foodborne pathogens. And it instructs health departments to devote more time to the riskier establishments. Next slide, please. So this here is a cutout from Appendix 4 in the FDA food code, which Massachusetts has adopted. And I apologize if it's a little small, but this gives a basic rundown of the 4 levels of risk-based inspections. And there's 4, 1, 2, 3, 4. And each of them correspond to the number of inspections those types of establishments are that should receive annually. So let me give a little bit of detail for each of those. Next slide, please. So level 1 food establishments are retail stores, typically gas stations, convenience stores, golf stores, or like places like Marshall's that just incidentally serve food. All of their food is prepackaged. All of it is usually not even temperature controlled, so it doesn't even need to be refrigerated to stay safe. Mostly just snack foods. These places are not a risk. So under this, under risk-based inspection system, these would only require 1 inspection annually just to make sure that the conditions of the store are clean and hygienic. Next, please. So at risk level 2, we've got minimal food preparation. So this, you have your coffee shops or very small specialized restaurants where they have a very limited menu and most of the preparation is minimal, if any. So they're heating up food or they're making smoothies or coffee where the ingredients require temperature control, but there's very little risk for, less risk for contamination at each preparatory step. So these, just like how we did it in the past, only require 2 inspections per year. In addition, any establishments that have a history of being very compliant would also get put into this section. Next, please. Now, at risk level 3, you've got your full service restaurants. So any restaurant that has like a fairly robust menu, complex preparation steps, thorough cooking of meats from raw to prepared, various different foods that need to be put together. Again, a full sit-down restaurant or the like. These would require 3 inspections annually. This would allow us to better monitor and better educate business owners. If we notice anything off, we would have more opportunities to communicate with the business owners, make sure that they can keep track of their processes and have good managerial control, just so that they can minimize those risks of contamination, so that they're washing their hands, so that they're keeping an eye on their refrigerators, making sure that they're cooking things correctly. So that 1 more inspection per year. Next slide, please. Risk level 4 establishments are the ones that we really want to keep an eye on, because they're either using some very complex processes. So they're making, say, sushi rice, which needs to be monitored very carefully, because there's a high risk of potential contamination if it's not done correctly. Handling shellfish, which has a very high rate of infection from various pathogens if it's not properly stored. Or if they serve a very vulnerable population, the elderly, the very young. So nursing homes would be level 4. And regrettably, if we have any establishments that are doing poorly, if they're full service restaurants, but we frequently see violations again and again, especially if they repeat, then we might want to follow up with them more frequently just to help them get into compliance. So they might be temporarily put as a level 4, just so that we have more opportunities to get in touch with them. Next slide, please. So the proposals, respectfully, is weird. The reason why Peter wanted to bring this forward is because he feels, and I agree, that the risk-based system would allow us to kind of focus our attention on the restaurants that need us the most. So those restaurants that have the most complex cooking processes or frequent violations or serve very vulnerable members of our community, we'll be able to inspect them much more often, so we can have kind of a better finger on the pulse in order to prevent these infections before they can occur. And this will also allow us to kind of step back a bit from the establishments that have proven to us that they know how to take care of themselves and that they have a solid understanding of safety and sanitation. This will mean that for the most part, we will have to inspect 60 more times annually in total, based on the number of establishments we currently have. But I thoroughly believe that this is a worthwhile effort, and that we should definitely take advantage of this to better safeguard our community. And that's all I've got. Thank you for listening.
Excellent job, Daniel. There's nothing I can add to that, except I'm very proud of the folks that I'm working with. It's a great team of bright young folks. And I'm going to turn it back over to Rick. We're going to need a vote on this.
Any comments, questions for Dan, or concerns? Go ahead, Karen.
I'm just curious, is this something that, how do I phrase this? I guess, is this something that would you plan to do a mailing or email or some kind of communication to the establishments to let them know the change in process? Once we were accepting, I'm fully in favor. The presentation was excellent, and I think it's wonderful that we are moving in this fashion. This is right in step with the best practices for public health inspections. But I'm just curious about how your outreach will get managed.
Go ahead, Daniel. You got something to say on that?
Honestly, I was going to actually defer to you. I did just want to note that a few of the establishments that I've been visiting, either casually or at the same time as an inspection, I've been letting them know that this was in the works and that there was a distinct possibility that it might be implemented, and just so letting them know. But I would also suggest that maybe an email or a newsletter or something like that a more formal thing might be worthwhile also.
Yeah. Thank
You know,
you.
Yeah, usually when something new comes up, when we were doing the grease trap, we sent an inspector to just hit every place with some pressing of the flesh, I like to call it, and let them know that we're here and what's going to be changing. We might want to, I don't know, we can talk about it, but maybe Schwung will put something up on the website because if we just send off an email to them, they might cause more questions than we need. And we're going to be going in all I can, Daniel can talk to our 2 contracted inspectors and just make sure that the message is getting out there consistently. And yeah, thanks, Kerry. That's a good idea. And I guess I don't have a solid plan, but we'll be doing something just to make sure they're there. Gene?
Yeah, so we can help out. We have very strong relationships with the business community. We have an economic development director, Erin Schaefer, who's does a weekly walkabout in downtown, for example.
Okay.
So we can all kind of work together to get the word out. The other thing I might suggest is it's actually not that far away to put Jackie on the spot to do the renewals. That's coming up. And we communicate with everyone at renewal time. So I always want to get them started as early as possible, right after the 4th of July, let's get the renewal paperwork out there. But Jackie's a whiz and she gets it all done. And so maybe we can, again, use that opportunity when we communicate with all the food establishments to, describe this. And we have a rock star public information officer in Jane Wellman, and she's awesome. So we can work with her and just give it the old team effort to get the word out. So no surprises for anybody.
Yeah. I mean, and again, I think it's a great, I think it's all a positive in my mind, so I just think that outreach is good. Thank you.
And if I could just jump in, one more little bit of reassurance. We've, prior to bringing this towards you, we've already reviewed all of the establishments and given them a preliminary classification already. So that's where I got the 60 more inspection number, because I tallied them all up.
Yep.
Thanks, Daniel. I think Mr. Bocci had a hand up through you, Mr.
Thank you.
Chair.
Thank you, guys. I think this is a great idea. So 2 questions, I guess. After the board votes, does this get implemented immediately? That's question number 1. Or is there going to be some lag time for notification? And with 60 more inspections, is there enough staff in the pipeline to do that?
The implementation will ease into it. We're going to have to, get our lists together. We already began. And I mean, I don't really see much need to delay. And I don't see where anybody needs to be prepared. I mean, it's not going to rock their world that we're going to come in one more time or one less time for that matter. B, we have contracted inspectors doing the bulk of well, I shouldn't really say that. Daniel is out there too, but we have contracted inspectors and budget to do this. So we crunched the numbers with the contractors, and the short answer is yes, we have the resources to do this.
Thank you.
So, I guess with 60 additional inspections, that's essentially 1 a week, maybe a little bit more over the course of a year. Can I ask Daniel, did you say that this risk-based food inspection approach was adopted by the Commonwealth in 2013?
Not so. From my understanding, this appendix was introduced into more recent versions of the food code. So the FDA releases its own food code every 4 years, and up until I believe it was 3 or 4 years ago, Massachusetts was still using the 1999, and they very recently adopted the 2013 edition. And in that edition, in the appendix, it describes how to transition to a risk-based inspection. So a lot of other communities have taken advantage of that and started doing this.
Okay.
And to be clear, Rick, it's not a mandate, and that's why we're here tonight looking for a vote to enroll in this program. But there are communities that are not as dynamic as Reading, and so I think we should be, leaders in the field.
I agree. Yes, Carl.
Agreed.
Sorry for all the questions. Is 2013 the
I
most
know.
updated?
You're right.
That's a really good, you picked up on that right away. And it seems crazy that we're like 8 years behind in our food safety programs. This is at the national level. And I mean, they keep touching it up and the Commonwealth keeps moving ahead, but yeah, we're using 2013 regulations. I think the latest though that came out, and I'll take a stab at this, might have been 2019.
2017.
2017. So, it's a dynamic field, food safety, but the science doesn't change that much.
No, correct. Yeah, I'm heavily inspected. I'm in the chocolate business, so I get inspected by the FDA, not the local board of health. So I have a lot of protocols that we have to adhere to because we sell packaged items to the public.
Yep.
Interstate.
Well, we're state inspected, typically through the FDA either. So one inspector shows up, and usually they're contracted by either body. Sometimes it's a separate FDA inspection. Sometimes my FDA inspection will satisfy the state inspection. I just recently had an FDA inspection that did not satisfy. I shouldn't say did not satisfy. They did not contract with the state. So it was an FDA inspection only.
Yep.
They will provide that information to the state,
Yep.
but the state could come and do their own inspection if they wanted to. They probably won't. Chocolate is not a
Potentially hazardous food.
yeah, it's not a level 3 or 4.
Yeah.
My biggest problem is peanut butter, which is
Allergens.
allergens and can be recalled and stuff like that. So
Yep.
with the FSMA, with the Food Modernization Act that was implemented, that changed a lot for our industry, manufacturing.
Yep.
But the Board of Health, local level seems to be lagging, but this is a big step up from the way I look at it. I used to be in the food business many years ago. To have this tiered system that makes so much sense.
Thank you.
It's good that hopefully the board will adopt it. Thank you.
Carrie, did you have a question? Comment?
Just a comment. There are conversations happening regularly at the state level about the need to do some standardizing of food inspections so that the inspection that you have in Swampscott is the same as the inspection that you have in Reading and the like. But that's an issue of it's related to the food code and which one we use, but it's also related to manpower to be able to provide the staff to offer that standardized training. So it's on the list, and I want to make sure if anyone is interested in it and wants to advocate for it with anyone that they might know, that's it would be a great thing for there to be an opportunity to standardize food inspections. And I think I heard Daniel kind of concur with me.
Well, I'll say this before we get too far off, because we got to focus on getting the risk base. But Danvers, when I was there, was the first community in Massachusetts to sign on to the voluntary FDA retail food standard program. And it is a great idea. I mean, you can have an inspector wake up on the wrong side of the bed and cause a lot of trouble for people. Once they get standardized, everybody's looking for the same things and hopefully the same temperament. But that aside, thanks, Kerry. You'll be hearing from us, I'm sure, at some point about that. And that's feasible. It's free, and it's just a matter of getting things done. But back to the issue at hand, Rick.
Yeah, so I'd like to make a motion that we adopt the risk-based food inspection program as presented tonight, and do so effective immediately. we'll obviously do that appropriately, but do I have a second?
Second,
Second. Roll call, Paula,
Yes.
Carrie,
yes.
Rick, yes.
Thank you.
Thank you.
That's great. We did a lot. And we're not quite done yet because I just want to introduce what we'll be talking about, if not next month, the month after. I don't want to get too pushy here for the short time I'm here, but there is a great movement about on the plan reviews as they come into the Board of Health. We get stuff that's hand drawn, and that's fine too, but really it's the most important part of food safety. I think if you design a food establishment properly, then taking care of it is easy. But if you never have one that's built right, it's going to be a bear. It's going to be a pain forever. So I might be sending something out. I'm not going to be looking for action right away, but there are communities. It's a growing interest to have a requirement around plans before we receive it here at the staff level, that someone on behalf of the restaurant is going to be looking at it and making sure that, they use words in the code like acceptable and adequate.
Yes.
And you can convert that now into cubic feet of refrigeration and linear feet of storage and gallons of hot water. And, if you have all that stuff in place, as I've said, so I'll introduce that for next month. We've had enough about food safety for now. Let me go back to sharing the screen and finish up our monthly report. If I may, naturally, if you have questions, I'll take them anytime you want. But the only piece I think that's not covered right now is the 625 Main Street, which is the 5-story building right down the street from Town Hall, which is now vacant because of water damage that destroyed the electrical system. Daniel and I have been in there on complaints for the last couple of months, water leaking in from the roofs, and we really couldn't substantiate it because of the issues of getting in there in timely manners. And, it's chasing leaks around rooftops and as they come through the ceilings. And it's not easy, but we were getting there. And then this happened. And so I'm sure members of the board are aware of this event that occurred in town just the other night. And there were, correct me if I'm wrong, please, 39 doors in that place, 39 different separate dwelling units, and at least one person living behind each door that is not there. And Jean was first on the scene, brainstorming with us about, how this is going to affect us and how are we going to get some help out to these folks. And the state, all the way up to in the town manager is basically has this. I just want to assure the board that we know what's going on, and there's a lot of unanswered questions moving forward. But the owner of the property has voluntarily agreed to put these folks up for the next 2 weeks. Can't live out of a hotel room easily. I know that from what happened in Danvers when they were filling up the hotels with homeless folks. But we're actively involved. If Jean wants to add anything, she certainly may. You there, Jean?
Yeah, thank you. So the town manager is taking the lead in working with the area resources, community partners, other town managers. We've been in touch with the Housing Authority. I sent an email blast out to all of the multifamily property management companies, like we've done in the past in health. We have that database, and just putting the word out to see if we can be a facilitator of any kind. We are also working with some of our financial partners to see if there's a way that the community could respond. And so I can't say a whole lot about that, but there are some things that we're working on so that we can be ready and have a mechanism in place if the community would like to donate and that kind of thing. But there are some other things that we're working on. I can't really go into it all, but we are working hard to make sure that we can help the people who've been impacted. And it's my understanding that of the roughly 39 households, about half of them require housing. I think from my understanding, and that's second or third hand, so take it for what it's worth. But thankfully, it sounded like at least half of the households had other arrangements, whether with family or friends or whatever. So hopefully then the number in need will go down even more now that people have had a little more time to make plans. But whatever that need is, we are working hard with all of our community partners and all of our resources to make sure that they're taken care of.
Great.
Thank you.
That's
It's a
great.
big deal for Reading, I think.
Yeah. Carlo?
Thank you. Jean, can you share, or if you know, was there any, I don't want to call it structural damage, but other than the electrical system, was there any more significant damage, or that hasn't been assessed yet?
I did speak with the Commissioner of Buildings. As you know, that's my department as well. And we actually sit opposite each other, so talk all the time. And I did ask him for his opinion of what's needed, how much time will it take, what's the extent of the improvements needed. And it sounded like, from his perspective, the real issue is the electrical system. But I will say, from what he told me, the property owner is moving quickly. They've already had an engineer design what's needed, and they'll be starting, I think, tomorrow. Everything's been laid out of what the improvements are needed, and the engineering plans are designed, and so that got done within a couple of days. And the property owners have committed to find a company who can do the work as soon as possible, not shop around for quotes, but just find a company that can get in there and get it done. So fingers crossed that this can go that way, and there's not too much of a hiccup. And construction now it's so difficult because of mainly how busy everybody is, and then how difficult it is getting supplies. So
yeah.
I'm a little worried about that part of it. But as far as other improvements, it's an old building. I think the town is trying to look at this to say what needs to be done critically now to make the building safe. We're not going to bring people back in the building safe. But we're also not going to go looking for trouble, and we want people to be safe and back in the building.
Right.
Whatever that looks like. But from what I understand right now, it's mainly the electrical system.
Thank you.
Okay. Thank you for that report, Peter.
Yeah, that's your monthly report.
Appreciate that. Appreciate all the staff work that went into that. It's a lot. So next item, minutes from our June 17th meeting that got distributed earlier this week. Looked fine to me. Any edits, suggestions, comments?
Nope.
Looked
Thank
fine.
you, Jackie.
Yeah, just to thank you, Jackie.
Yep. Thank you, Jackie.
Good job.
So I'd make a motion to approve the minutes as submitted for our June 17th meeting. Do I have a second? Paula, second. Roll call, Carrie?
Yes.
Paula?
Yes.
And Rick? Yes.
Thank you.
And thank you. And last, just in terms of dates for our meeting starting in September, I think Jean pointed this out at our last meeting, that the third week in September, third Thursday rather, September 16th is Yom Kippur. So we probably need to move that meeting. And it turns out that the third Thursday in October, which is the 21st, is the town meeting, I think. Is that correct? Jean? No?
No.
I thought there was a conflict in October as well.
No, it was September and November.
Okay. So I guess October would be fine. November is the town meeting, and then December, there's no conflict, although it's pushing up against the holidays. So one suggestion was potentially to move September through December to the first Thursday of every month, as opposed to kind of the third Thursday and then the second and then the first Thursday, and kind of alternating gets a little confusing. The first Thursday of the month would resolve the September problem. No problem in October, but it would resolve the November problem. And in December, it would move it a little earlier around the holidays. So, which always is a busy time. And so I don't know how people feel about that. When we switched to our monthly meetings, we did say, reserve the first Thursday for emergencies, and we actually did that once. So hopefully there's not a problem with that. So any concerns or issues around starting in September, moving to the first Thursday through the end of the year, and then in December we can take a look at, January. Everybody's good with that?
Actually, as a matter of fact, the only consistency that we've had with meetings is our inconsistency over the years. We move these things around everywhere, so I think the public's even used to it.
Yes.
Okay.
Okay, so we're good on that.
Yep.
And with that, there aren't any other urgent items. Carrie?
Oh, I said Jean beat me. She was the first.
Jane? No?
I just want to say I was really happy to see Paula's and Jerry's paperwork back in
Yes.
to rejoining us. And
Absolutely.
thank you for doing it. We're really happy you're here. I really enjoy serving with all of you, and thank you for doing it.
Absolutely. Totally.
Well, thank you.
Yeah.
Just my 2 cents worth. First to Kevin, desperate times require desperate measures. So we do bounce around, but we try not to.
Mhm.
B, this is important. Stability in this board is very important to me. So again, thanks to Jerry and Paula for sticking with it. We got a good thing going here.
Thank you.
My only little comment was, and it's fine, but September 2nd is the Thursday before the Labor Day week. Labor Day's on the, so,
There's always something.
yeah.
Yeah.
As long as that's okay, I just want to make everyone aware of that.
I'm cool with that, yeah.
I think it's no issue. Yeah. Okay.
Like to make a motion to adjourn.
I will second that one.
Second, roll call, Carrie,
Yes.
Paula,
Yes.
Rick, yes. We
Have a
are
good
adjourned.
evening,
Thank you,
everybody.
Night,
Enjoy
everybody.
the summer.
Thank you.
Thank
Yeah,
you.
Nice to see you all.
Nice
Take
to meet you,
care.
Mr. Bocci. Thanks for coming.
Yeah,
Yes.
nice to see you, Carlo.
Thank you. Thank you. Bye.